Hi, this is Dr. McGee. Our team is getting everything ready to help you through your total knee replacement surgery. I want to go over some of the details so you know what to expect. The first thing we want you to know is that if you have any questions or concerns after your surgery, you can call or text the main office number. It's 702-485-5885. Even if it's late or a holiday, the answering service will get a hold of us. First, the surgery will take about 45 minutes. You'll be in the operating room for a total of about an hour and a half. You'll be in recovery for an hour after we finish, and then you'll be ready to go home. I explained some of the details of the procedure in the office, but I'll go through more of that now. You'll be under general anesthesia for this surgery, which means you'll be completely asleep and you will not feel anything that we do during the procedure. Anesthesia will also talk to you about a nerve block, a procedure to numb the knee that greatly decreases the pain you'll feel after surgery. It won't completely eliminate all pain, but it helps quite a bit. This block should wear off within about 8 to 24 hours. These will be the basic steps of your surgery. We make an angled incision on the front of the knee to expose the joint. Cuts are made on the bone to remove the arthritic surface. We measure and trial sizes to get a perfect fit. The final implants are then cemented into position. Here's a short cartoon to review how that's done. When we are finished, we close the wounds and all the stitches will go underneath the skin like a plastic surgery closure. They'll dissolve over time. There'll be no stitches or staples that have to be taken out. We also use a glue on top of the wound that helps keep tension on the wound and also serves as a cover for the incision as well. There will be tape-like bandages on top of that called steri-strips. They'll stay on until they fall off, or we'll take them off at the 2-week visit. You may have additional dressings and gauze on top of your wound, and that can be taken off the day after surgery. You will have a soft sleeve or ace wrap on your knee. You should wear this for the first 24 hours to help with swelling. Then you may remove it. You can take a shower 2 days after surgery, and it's okay for the water to run over the steri-strips, but don't scrub the area. You will receive a separate video that goes through the medications that are helpful after surgery for pain, nausea, etc. Use an ice pack or cold therapy machine on your surgery site for 20 minutes every hour while you're awake the first 48 hours after surgery. After that, use it as needed after activity or physical therapy. Remember to place a cloth or a thin sheet between your skin and the ice when you're using either an ice pack or the cold machine. Physical therapy typically begins the day after surgery. You'll receive a copy of the referral as well as the therapy protocol after your surgery in a folder. Please take this entire folder with you to your first therapy appointment. Occasionally, we delay the start of therapy depending on what's found at the time of surgery. If you have any questions or concerns, remember that you can call or text the main office number. Also, this is a general guideline, and there may be unique issues related to your particular case. At any point, if you have questions or concerns, you can call us. So we've gone over a lot of information. There is going to be a time the morning of your surgery before your case, and we have plenty of time then to answer any additional questions, or if you need clarification about any of the topics that have been discussed in these videos.